Thank you. It's an honor and a privilege to share with you today. I wish I could be with you in person to discuss this very important topic, the mental health and well being of our staff. I should be returning at this day from a trip of a lifetime to a 12-day tour in Israel. So I grew up as a preacher's kid in Virginia. My dad, a preacher, retired minister, now 90 years old, will be on the trip he has wanted to make for 40 years. So we're very excited as a family, and I apologize for not being with you to discuss it in person. I'm glad for the technology that I can still share with you on this very important little personal note. I attend Calvary Church in Grand Rapids, married with 3 kids. I have a girl and 2 boys, and I just got a text about an hour or so ago from my wife that my oldest is beginning contractions. So you are looking at a future granddad. In fact, I might be a granddad as you are listening to this presentation, and soon to be known as Pops, because that's way more cooler than granddad. And more cooler is the proper definition, proper term there. So thank you. I'm really excited to be here. My 31-year career has been serving nonprofit Christian organizations in the area. And so I'm really excited to talk about this topic, especially now. Currently, I serve as the CEO of Wedgewood, and Wedgewood has been a staple in this community for 62 years. And in that time, a lot has changed, but Wedgewood has always stayed close to our mission. As a bona fide Christian organization, we extend God's love to youth, adults, families through professional counseling, residential and community services. We stepped in to provide care and compassion for some of the toughest cases facing children and families. Situations like child trafficking, abuse, trauma, substance abuse, and the devastating effects that has on communities and families. With this love and grace that we hold so dear, we show our clients what's possible with the right supports. Like you, many of you, these last 2 years hasn't been easy. It's been hard, and the challenges presented by COVID-19 were unlike anything we've ever encountered. Right, despite these obstacles, Wedgewood remained open as an essential workforce, and these children and families we serve were able to continue the therapeutic care on our campus, online. We all pivoted, right, and in some cases in person in residents' homes. Our residential program still achieved 91% success rate on helping kids stabilize and return to a more stable environment. And our substance use disorder and our community services saw nearly 1,000 clients in the 8 counties around Kent County in West Michigan. I'm proud of all these accomplishments. And as important as outcomes are, right, it's the people we impact, empowering, hopeful lives that matters most. The declining mental health that we've seen has intensified by the COVID pandemic, but it actually predated it, and the term that we reference and use, we've been using a lot lately, is this mental health tsunami. This wave, like 2 tectonic plates colliding in the ocean with the ongoing crisis plus social unrest, created this wave, and it was heading towards us. And the intensity and of the experiences of the prolonged COVID has only made that experience work. The ongoing pandemic has accelerated the arrival of this mental health crisis, and it has resulted in what I believe and many believe is the arrival of the greatest mental health crisis of our generation. And we're already seeing the effects of it indiscriminately wreaking havoc across community demographics. A study by the Centers for Disease Control and Prevention showed mental health emergency room visits from April to October of last year increased, get this, for children ages 5 to 11 years old, and 31% increase for adolescents aged 12 to 17. In a follow-up report, the agency said the pandemic was particularly hard on adolescent girls. Suicide attempts were up 51% this year over the same period the previous year. Locally, the most recent Kent County Community Needs Assessment shows 1 in 4 adults have some form of diagnosed depression. 1 in 4 adults. That number is actually 1 in 3 for young adults ages 18 to 24. And the report concluded, this is the Kent County Community Health Needs Assessment, concluded that mental health is one of the top priorities of our community. And we can see that this decline only got sharper during the pandemic with increased anxiety and depression and suicide. And cognitive, we're now kind of referring to it as the cognitive implosion. Individuals are waiting up to 6 months to see a psychiatric doctor, and 4 to 6 weeks just to see a therapist because of the intensity of the COVID pandemic on our mental health. And our kids are not not immune from this, and that is affecting our families, because these kids, these young hearts and minds are feeling in those developmental years the prolonged effects of isolation and stress and anxiety, and that affects the whole family, doesn't it? And what are we seeing in the workforce? We're seeing burnout. There is a collective languish, a COVID-19 fatigue of sorts, but that has nothing to do with the virus, but has everything to do with the aftermath of this chronic and persistent anxiety and stress that comes with this uncertainty. Our frontline staff at Wedgewood, during that essential time period of reporting to work and wave after wave of COVID, we saw on our frontline staff an 84% turnover. That's devastating, devastating. At one time, we had on our frontline staff 45% of our workforce out with COVID at one particular time. Now, we don't get to not show up for work, right? In the sense that people need care, and these kids that are survivors of human trafficking, or individuals in crisis with substance abuse or something else needs our care. We cannot not show up for work. So we, like many other organizations, struggled in that environment. I think as we think through the problem, so we kind of framed what we've already known to feel, right, and to have experienced, and what's going on around us. We added some numbers to it, but we know that. I think it's also important to understand the target, the new workforce, if you will, and align the expectations, giving the new workforce, combining that with what's going on around us. So we can, as leaders and Christian leaders, be able to provide solutions in this time for our staff. And the new workforce, the millennials and the Generation Z, the Gen Z group, have a unique expectations, never before really being experienced and unique in the 80 years that Gallup has done surveys on our workforce. And they did a recent survey, 3 million workers, I think in 80 different countries. And this is what they found, that the new workforce doesn't want to work for a paycheck. They want purpose. They no longer are pursuing job satisfaction. They are pursuing personal development. This new workforce, millennials and Gen Zs, don't want bosses. They want coaches, the coaches that ask questions and help them discover a pathway forward, as opposed to telling them what to do as the wise sage in the room. And no longer are we the wise sage in the room all the time, because every worker has one of these, right? And has a bigger brain and more access to more resources than we could, no matter how many years we bring to the conversation. The new workforce, it doesn't want annual reviews. They want ongoing conversations, that's focused specifically, a recent Wall Street Journal talked about this, that focused specifically on development and performance. So tying back to the previous conversations, they don't want to just be told where the deficiencies are. They want to have an opportunity to develop and grow, as well as saying, hey, what matters and how are you doing? The new workforce wants us to focus on their strengths, not fixate on their weakness. And the new workforce cares a great deal about their job, because a job is their life. Having a good job is having a good life, and having a good life is having a good job. That's how the Gen Z and the millennials are looking at their work. And how devastating was it in that environment? This study came out right as the COVID hit, that we went remote, we went virtual, we lost those connections. And for a workforce that relies on that, how devastating is it then to have to pivot to a place where they're isolated and disconnected? As good as technology is, as meaningful, as effective, as efficient as it helps us out. And so when we think about that workforce and we think about them valuing job and valuing the job and the life, and the life and the job are more aligned than ever. 80 years ago, the response was security, peace. We wanted, a family and so forth. And all those are very important. But right now, job is moved from 5 or 6 in the priority list up to 1 and 2. It's really, really interesting. And so when we disconnected from our jobs, that had an effect on our workforce. So we need to ask ourselves as leaders, does this organizational value value the staff's strengths and contributions? And put from the individual's perspective, does the organization value my strengths and contributions? Does the organization give me the chance to do what I do best every day? And am I able to see this job opportunity as connected to my beliefs and my values? And we've seen this. This is not a career move. They will adjust the job to their beliefs and systems, and hence the whole gig work environment. And so it's a commitment to a belief in a deeper way. And there's also a deeper thinking about work and life and work. And I would just say this: the great resignation that we've experienced in COVID. What we're finding now, it's very interesting. Again, a recent article in the Wall Street Journal talked about that there's a great languish about the resignations that people have. So changing the job didn't quite work out as it did for this generation. And I don't know what to think about that, but there is a languish that it's in those individuals that had during the great resignation these last couple of years. And therefore there might be an opportunity as leaders to recapture, re-emphasize these things. So when we promote our organization, when we deliver on our brand promise, I think the individuals on the right side might go a long way to recapturing those individuals that made that shift during all of those changes that we experienced in 2020 and 2021, and an opportunity for us as an organization to really kind of align who we are as an organization to the new workforce expectations. And so what does that mean to the workforce? What are some solutions and resources that we might consider? Well, traditionally, it's been a good value, a good product has been the employee assistance programs or the employee assistance centers. And these offer short therapy opportunities based off of a fee. And usually the fee for the organization is based off of how many employees an individual has, that can receive a very short stint, usually about 3, maybe as many as 5 sessions from a trained therapist, and the organization covers that. And this is of value when somebody's going through crisis, divorce, or a mental health breakdown, or a struggle with family members or youth, and so forth. It really is value, but it's more reactive. It's more of when there is a problem, when there is a crisis, when there is a situation. Feeling EAP, EAC programs are great programs and helpful. But more and more organizations, and this has been Wedgewood's experience, is understanding that we might need to be more proactive and focus on wellness. or some organizations are adopting mental wellness workshops, establishing mental health days. This is days in addition to sick time or paid time off or earned time off. Some organizations are thinking about on-demand meditation spaces. That might be areas that have certain lighting or aromas, or pictures, even videos or music in certain areas for individuals to disconnect, and to maybe recharge. And some are finding that to be a helpful space. And then the other one that I think is really interesting and is the growing opportunity of these on-demand wellness apps. Companies pay a subscription fee for their staff to access at their leisure. So BetterHelp, Calm, Headspace, Talkspace are all popular and gaining popularity there. And this is really interesting because you talk about the new workforce. It may not be that they receive therapy in an office space or even virtually through Zoom or Teams. They may receive that connection through text message, and anytime, any level of support, anywhere. Isn't that amazing? And if you grow up with that, that is, the phone is an extension of yourself, right? Then this application for that new workforce might be something we should consider. Allwell is a Blue Cross Blue Shield platform, and this is an interesting business model where they offer this to their members, and you can access that platform anytime. And they have different ways to do that. Schedule a face-to-face, do text message support. There's no deductible, no copay. And from the provider's perspective, they're looking at this as a loss leader in the sense that they are able to connect early on and may spend a little bit up front from a resource development of this app and supporting it with trained professionals. But the idea is that we're still thinking about this as preventative before there's a crisis, before there's a breakdown, before more help is needed. And so what they've done is they've hot-spotted their whole membership piece, and they've identified certain individuals that we would connect with them at the right place, the right time, using this app may help that individual be well and benefit them long term. And guess what? As a provider agency, as a HMO, they also benefit. Very interesting solutions, and you can see that it really moves from reactive to proactive, reactive, and in real time. Pretty amazing stuff that's available to us. So as an organization with limited resources, we live on this side of the fall, right? We don't have unlimited resources to throw at everything all the time. Here's what I think is some really good ROIs. And it comes down to the basics: sleep, exercise, and in-person connection. We are and imagine a wellness program in your organization where you actually track and promote the level of sleep that your staff are getting. We have these watches and connected to devices, and imagine a game or a gamification program where you track that and compare it to each other and reward your staff for getting 7 hours of sleep or 8 hours of sleep and so forth. Interesting concept. Exercise and in-person connection. Are we tracking the amount of hours that our staff are face-to-face, going from meeting to meeting to meeting to meeting? And at the end of the day, 7 hours, 8 hours, they've had 5 minutes maybe to stretch and move around. And so are we tracking that in person, and are we finding ways to manage that with our needs to connect in person with each other? And I think there's good ROI there. And research has shown that sleep, exercise, in-person connection has made a significant impact in youth and their development. I think it also applies to us as adults. And then the other thing that I think is value is don't wait for staff to have a crisis and reach out. There's still, as much as this conversation is very helpful to help overcome the mental health stigma that is someone, I'm seeing a counselor or this or that, and just what that is. Staff don't always know that they're in crisis, the frog in the kettle, so to speak. And we don't know that things are getting worse around us, because one thing that we can handle is one thing, is one thing, is one thing. It's never, and I just heard this, a sermon just the other day, it's never the first hill that gets you, right? It's the sixth hill or the seventh hill that gets you. And it may not be a steep hill. It just represents that hill. And we all have a number. There is no one of us this side of heaven that has an unlimited number of hills that we can overcome. So there always is going to be that hill that gets us. And so we don't know where that is. It may be when in a meeting you say, hey, Jane, can you take care of this for me? I'm doing something else. And that person you could just see just breaks, because that's their last hill. And how do we deal with that? One way to, I think, to deal with that is don't wait for staff to contact you. Don't wait for the breakdown. Find and organize an intentional way to reach out to staff. And all it is saying, how are you doing today? When I was a young supervisor, and I hesitate sharing this with you because it's a little bit embarrassing, but I wanted to show my boss that I was good at my job. And the first supervisory job of 65 direct reports, believe it or not. And I created a disciplinary matrix, and I had if you do this, then this happens, then this happens, then this happens. And it was all laid out. And I was so proud of it. And I had my folder there and a disciplinary matrix in big bold letters. You walk into my offices right by my head. You could see it right there. Don't make me reach for the disciplinary matrix file, right? And it was all organized. It made sense. It was logical. It was horrible. It was a failure. And I wonder why everything was so difficult. And I was a pariah. Well, right. And finally it took a good coach to say, set that aside. And I took all those papers out of that disciplinary matrix, the note to file, follow up with the conversation, written warning, second warning, third warning, and created a Barnabas project. And the assumption in the Barnabas project was everybody has a need to be connected with outside the context of work. And I said, once every 30 days, maybe it should be more than that. And so I recorded in them everybody's name and what was the favorite NASCAR driver? What is the favorite thing they make for Thanksgiving? What is their favorite grandchild, even though they don't have favorites, grandchildren? What is the best vacation they ever took in their life? Where are they heading? Where are they going? What matters to them? And I became the Barnabas Project, the encouragement project. And so my whole focus went from, let me track where you're doing right and wrong on the weakness side, to where are you? Who are you? And how are you uniquely gifted to be a part of this team to help us move forward, because God has crafted us that way for a purpose, isn't it? Don't wait for staff to break. Reach out to them. Create your own Barnabas project. Be the son of encouragement. Our Wedgewood response was rocky at first. 84% turnover is devastating to us. We have a care for the caregiver program. As professionals, counselors, we are subject to second-degree trauma when individuals, youth, and families are dealing with the worst times in their life. And we get to be there during that time. And it's a privilege and an honor, but we are not disaffected by it. And so that has an impact. So we created this care for the caregiver. It was ongoing before the pandemic, but we needed more. And then that group created another group. They called themselves the Just Because group. And it might've been the most brilliant group ever created. And it was simply this: we care about you where you're at, no matter what. And whether it's lollipops on Valentine's Day, whether it was a card because it's a Tuesday, or if it was a call saying, how are you doing today? As a CEO, I got at least one call, and I got numerous handwritten notes to me saying, hey, we're praying for you. We're encouraging you. I can get emotional just thinking about that. So these wellness calls helped sustain us during 21 and the end of 2021, with the pandemic reaching what it did was devastating to us. I don't know where we'd be without that group. So that's our story. And thank you for letting me share it. And hopefully there's some ideas there that you can apply where we're at as a community and as a responding to this pandemic, with aligning it with the expectations of this new workforce, combining with who you are and what you're gifted with, and what your team is gifted with. And there might be something here that you can catch and move forward. So thank you. I've been asked also to share my personal testimony. Thank you. As a preacher's kid growing up in Virginia. I came to Michigan in 1987 to go to school, and planted a family and stuck here. Well, I love West Michigan, but I joke, as a preacher's kid, we weren't at church whenever the doors open. We were actually already there opening the doors. And so church and life and family were all synonymous. My dad was saved late in his life at 17, and I got to see lived out every day an authentic Christian who loved the gospel because he knew what he was beforehand. And when I've never heard my dad speak in front of any group without sharing the gospel, that he was a wretch saved by the grace of God, and his whole life is dedicated to sharing the gospel and what that meant to him. And he always considered himself a youth pastor because he felt like this old stat that if by the time a child reaches 18, their chances of finding Jesus are less than 15%. And so he always considered himself a youth pastor, and he pastored churches, but he also started mini camps, and that was just a part of our work. Most recently, Dad was the executive director of Grace Adventures up north in Upper Silver Lake there. And that was also part of our journey. And so work, church, and family were just synonymous. And I had two amazing parents, still do, that reflect that on a day-to-day basis, in and out. And so it was never a thing to think about who we are as a person and how we live out our salvation, because I saw it. With that, I was 4 years old. I came home from church and I said, hey, my brother Steve, I heard about this hell thing. I don't like it. I don't want to go to hell. And he led me. And I remember that I was 4.5 years old, knew exactly where I was, and knew exactly I was on the lower bed of our bunk bed. And he leaned over and then he sat down on the bed, and we prayed the prayer. Then when you're 4 years old, you got to make sure at 8 and 12. But being in and then went into Grace and pursuing a pastoral program. I did an internship up in Muskegon as intern pastorship for a year. I'm blessed to feel like my work and my life as a Christian, I don't have to turn anything off. And that was the way I grew up with Dad and Mom and my 3 older brothers. And it's a privilege and honor to be able to do that every day. At Wedgewood, we have devotions before our weekly meetings. And it is, I don't know how during all of this, how we would have gotten through that without praying for each other, caring for each other, but also leaning on each other, bearing each other's burdens. So thank you.